Hi everyone, today we're going to talk about maca with L-arginine. So let's dive in. Okay, so we're first going to talk about what is maca and what is L-arginine, and then we're going to look at the health benefits of each one of these and then why they actually make a really good thing to pair together. So black maca, we have several maca products. It's a root vegetable from the Andes grown at high altitude, and it's very nutritive. Being able to grow under such harsh conditions has made it have many medicinal benefits, including responding to stress and giving the body nutrients. And so it has been used for years as an adaptogen as well as a sexual tonic. And scientific studies have noticed benefit in improving libido, increasing sperm concentrations, supporting testosterone production, improving mood, and responding to stress. And then L-arginine, it's an amino acid or protein building block that supports nitric oxide production. So nitric oxide, when released, is responsible for relaxing blood vessels and opening them up, which improves blood flow around the body. And it's because of this action that several trials have shown that L-arginine can improve erectile dysfunction, as this can be something that is due to poor blood flow and is often a first sign of cardiovascular disease. So looking first at maca, this study gave either 1.5 grams or 3 grams of maca, as well as a placebo group over 12 weeks. At 4 weeks, some people in the placebo group reported some improvement in sexual desire, and more people in the maca group also reported sexual desire. However, when we get to the 8 and 12 week mark, the placebo group completely drops off and reports no increased sexual desire. And we see that our maca group has further increased reporting improved sexual desire. And then it kind of levels off. It stays the same at 8 and 12 weeks. So what this tells us is that we should be taking maca for at least 8 weeks to see its maximal benefit, although people might start to see some benefits at 4 weeks. So it is something that we need to take longer term to see that benefit. And then while 3 grams offered the most benefit, there's still some improvement with the lower dose at 1.5 grams. It was noted that these improvements in sexual desire were actually seen without any effects on testosterone and other hormone levels, which is important because if someone is already receiving medication to help with hormones, we know that black maca isn't going to disrupt that and can be taken alongside those medications. So this study looked specifically at fertility and taking black maca. So over 12 weeks, 1.75 grams of maca versus a placebo group. We saw taking maca resulted in increased sperm concentration, sperm count, motility, morphology, and semen volume, which are all markers of overall fertility in men, which we see with that dose and that length. Again, 12 weeks, 3 months long is what we want to be taking to see these benefits. Finally, there's quite a bit of studies out there looking at maca for exercise and athletic performance. So this one study, 2.5 grams taken twice a day, so quite a high dose of 5 grams per day for 8 weeks. And they saw decreases in inflammatory markers as well as increased muscle endurance, strength, and agility and flexibility. So lots of different exercise parameters were improved with the maca supplementation. So jumping over to arginine. So we know it improves nitric oxide, and in this study, there was 98 men that had been classified as having mild to moderate erectile dysfunction. These first two, A1 and C1, are showing us the makeup of each of those groups. A1 is the arginine baseline. The light dots are those with mild, the gray dots are mild to moderate, and the black dots are moderate erectile dysfunction, wherever they got classified. And then same thing in C1, except it's the placebo group baseline, the number that are in each of those classifications. After 3 months, we can see that the L-arginine group, 24% of them actually were completely resolved for erectile dysfunction. That's the blue dots there. And then we can see the other people changed the class of their erectile dysfunction. Either moderate became milder, mild to moderate became mild. And then we can see in the placebo, which is the C2, this group here, we had 2 people formally get into the resolved erectile dysfunction, but we can see that far fewer people improved, and actually it looks like overall as a group their symptoms got worse. So the overall result was that 74% of patients improved their erectile dysfunction category versus the placebo group. It does seem that the higher doses, around 5 to 6 grams per day for at least 3 months, seem to be the most effective. However, again, lower doses of 1.5 grams per day were beneficial for some. And again, improvements, we need to be taking this for at least 6 weeks before we can see any significant improvement. So taking them together, these two ingredients really complement each other well because they're addressing this health concern in different but synergistic ways. So we know that BLACK MACA supports more sort of the energy, emotional, mood, libido side of things, helps the body respond to stress and fatigue, and sort of responding more to sexual desire. And then the arginine supports more the physiological blood flow to allow erections to happen easier. So putting them together makes a really nice pair. So some comments just on dosing. So we did see that both showed some benefit at lower doses, around 1.5 grams each, but many people might need more more than this, maybe getting into the 3 to 6 gram range. Again, 6 weeks, really 8 weeks is the minimum that we want to be taking this before we can decide if it's working for us, because that's what we're seeing in research as to how long it really takes to get the maximal benefit. Generally, overall, they're well tolerated. Just like most things, there can be some GI side effects. So these are quite high gram doses, and it might be better to start at a lower dose to also prevent these unwanted side effects and see if that works. And then if not, slowly work up to those higher doses. Just some precautions. L-Arginine can interact with blood pressure medication. So anyone who's taking those should check with their healthcare provider first. And then finally, I just wanted to do a quick comparison of the many different health supplements that can be used for men's health. So Shilajit is similar to Maca in that it is an adaptogen, can help with energy. It can maybe boost testosterone a little bit, and definitely has some memory support in the research. Maca, similar to Shilajit in that it is an adaptogen, but really focuses more on male libido. However, it doesn't seem to have this testosterone effect. So if someone doesn't want to affect their hormones, then Maca might be a better option since there might be some of that effect in Shilajit. Tongkat is kind of different in that we definitely see this higher testosterone boost. So if someone's looking for that and their testosterone levels they know are low, then Tongkat's definitely the way to go. However, again, if they don't want that hormone interaction, then they might want to stick with Maca and maybe Shilajit. Ginseng, it's kind of an overall vitality and immune booster. So it's probably less specific to men's health, but obviously boosting overall vitality and immunity and energy can help with men's health as well. But it's sort of a more general tonic than the others. And then finally, arginine, it's not an herb like the other ones are, but it does improve blood flow issues, which probably could be paired with any one of these other herb ingredients. I've put not a direct action in most of these, but really improving blood flow around the body is probably going to have some beneficial effects on testosterone and libido and cognition. Finally, just taking a look at our product here. So we have crammed as much as we possibly can into each capsule. This is the maximum amount a capsule could hold. So we've got 200 milligrams at a 4:1 concentration of Maca, which gives us 800 milligrams per capsule. The arginine, we've got 400 milligrams in each capsule. And so because we need to have those higher doses, we are going to be taking 2 capsules twice a day is probably the minimum dose that people want to do. And so that would give us 3.2 grams of Maca and 1.6 grams of arginine. But we did see in those research studies that some people might need to increase this dose a little bit higher than that as well. As always, if there's any questions, please feel free to reach out. Thanks very much.